Gentlemen over 60, I need you to pay absolute attention to what I'm about to tell you. I'm Dr. Sophie Caldwell, a physician with over 3 decades of experience helping men restore their vitality, their circulation, and that firmness they thought they'd lost forever. And what I'm about to reveal could completely change how you understand your own body. The decline in your erection doesn't start in your penis. It starts in the microscopic blood vessels that feed the cavernous tissue. And when they begin to close up, you feel absolutely nothing. No pain, no warning signs, nothing whatsoever. The science has proven this time and again. Researchers from the Journal of Sexual Medicine discovered that over 70% of men losing firmness had signs of reduced blood flow to the penis before any symptoms appeared. That means by the time you notice it, it's been happening for years. I know you can feel it. That peculiar tiredness in the intimate area, that delay in waking up, those failures that start cropping up, the feeling that your body no longer responds the way it used to. It shatters any man's confidence. But here's the truth nobody tells you. It's not age, it's not bad luck, it's circulation. And circulation has a solution. Today, I'm going to show you 3 extraordinarily powerful exercises that open up the blood vessels in your penis, restore blood flow, strengthen the cavernous bodies, and bring back a much firmer response, even after 60. There's something else. At the end, I'll give you a special recipe used in clinical studies to increase nitric oxide, enhance vasodilation, and achieve stronger, longer-lasting erections. But first, let me speak directly to you, the man watching me right now. If you're tired of the failures, tired of feeling less of a man, tired of that quiet insecurity that only you know you're carrying, this video is for you. Now tell me something. Do you think this is a brilliant topic? If you do, write down here in the comments, brilliant topic. If not, suggest new topics that will genuinely solve your problems and concerns. Right, let's crack on. Number 1, pelvic floor exercise, the muscle that supports your erection. Let me explain something to you as directly as possible. Your erection doesn't just depend on your penis. It depends on muscles located down below, between your anus and penis, what's called the pelvic floor. That's what pushes blood into the cavernous tissue and keeps everything firm. When this muscle weakens, you notice it. Your urine stream weakens, your erection takes longer to wake up, it fails more often, and it feels like your penis isn't filling up the way it used to. This is extraordinarily common after 60. The good news is this muscle responds brilliantly to training, and science clearly shows this today. Studies published in the Journal of Sexual Medicine demonstrate significant improvement in hardness and erection sustainability when strengthening this muscle. Now, I'm going to walk you through this exercise. Pay maximum attention. First, lie on your back, bend your knees, and place your feet flat on the floor. Leave your arms alongside your body, relaxed. Now, before lifting your pelvis, I want you to do that internal contraction, as though you're trying to hold back urine. That's exactly the sensation, gentle but firm. Hold it. Now, maintaining this contraction, lift your pelvis slowly, without rushing. You don't need to go high, just enough to lift your lower back off the floor and align your body in a comfortable, nearly straight line from knees to chest. Hold at the top for roughly 3 seconds. Breathe calmly, don't hold your breath. Then slowly lower back down to the floor. That's 1 repetition. Do 10 of these, slowly and controlled, and perform this 3 to 4 times per week. Very soon you'll notice more control when urinating and better response when aroused. Many men say their erection starts waking up faster. Just make sure not to strain your neck and don't hold your breath. If you're doing everything properly, you'll feel your glutes working. But the main thing is that internal activation down below, where it truly matters for your erection. This exercise is simple, quick, and forms the foundation for the other 2 I'll show you. It prepares your body to receive greater blood volume and improves the internal pressure that maintains firmness. Number 2. Lower limb training. Testosterone lives in your legs. Now, gentlemen over 60, let me explain something almost nobody tells you. Your legs have a direct relationship with your erection. When your lower limb muscles weaken, your testosterone drops along with them, circulation slows down, and blood arrives at your penis with far less force. This isn't opinion, it's pure physiology. There's research showing that leg exercises naturally boost testosterone production and stimulate the release of nitric oxide, precisely that molecule which opens up the blood vessels in your penis. And the best part, you don't need a gym or any equipment whatsoever. Everything can be done right at home. So imagine I'm standing beside you, guiding you through this. Press your back against a wall. Take a small step forward and start sliding slowly downwards as if you're going to sit. But don't sit completely. You don't need to go deep. Stay at a comfortable point where your thighs begin working. Hold this position for 20 to 30 seconds, breathing calmly and without rushing. If your legs shake a bit, that's good. It means your muscles are waking up. Then slowly rise back up and move on to the second exercise. Stand up, hold onto the back of a chair, just for balance. Now lift your heels and rise onto your toes. Rise slowly. Hold at the top for 1 to 3 seconds and slowly lower down. Do this 10 to 15 times and divide into 3 to 6 sets. This exercise activates the calf muscle, which works like a natural circulation pump. When it contracts properly, it helps push blood back through your body, including the intimate area. If you perform these 2 exercises 3 to 4 times per week, the changes will be real. Many men report fewer failures, greater firmness, faster response, and even a sensation of warmth in the intimate zone because circulation genuinely improves. Just be careful not to overload your knees by going too low in the squat, and don't rush anything. This is meant to gradually wake your body up and return strength where it truly matters. Strong legs means strong circulation, and strong circulation means a firmer erection. Remember, increase the load gradually, respecting your body and your current fitness level. Have any of you tried leg exercises before and noticed a difference? Drop a comment below. Number 3. The vacuum pump for opening penis blood vessels and restoring elasticity. Now here's where I need to be crystal clear because I've seen your comments asking, "What's this pump thing?" and "How do I use it?" Let me explain properly. We've now come to the most powerful exercise, especially for men over 60 who are already noticing more frequent failures. The vacuum pump isn't a toy, and it's not some fantasy. It's physiotherapy equipment used worldwide to restore circulation, open compressed blood vessels, and return elasticity to the cavernous bodies, precisely those structures that provide erection firmness. I want you to clearly understand what's happening. When gentle vacuum is created around the penis, blood is drawn inside with greater force, and this causes the internal walls to expand. Over time, this returns flexibility to the tissues, something many men lose with age, particularly after 60. Now, about this device that so many of you asked about. A vacuum pump consists of a clear cylinder. That's the pump or cylinder bit that people were asking about. It looks rather like a large test tube or flask with a hand pump attached. You can get them at medical supply shops or online. They're perfectly legitimate medical devices. The NHS even prescribes them for some men. They typically cost between 20 to 60 quid for a decent one. So listen carefully to do this safely and properly. First, you need to be relaxed, sitting or standing, but without rushing. The pump has a transparent cylinder into which your penis should enter completely. Guide it in calmly, without force. Make sure the base sits snugly against your body so air doesn't leak out. Then start slowly pumping out the air, just enough to feel your penis filling with blood. No pain, no excessive pressure. The correct sensation is gentle pressure, not discomfort. When you reach a comfortable pressure level, simply hold it for 10 to 15 minutes. Don't move it, don't increase pressure, just allow the blood to circulate. That's exactly how the cavernous bodies regain elasticity. If you feel pain, reduce the vacuum or stop. The goal is to stimulate, not to traumatize. Let me tell you something important. Many men, including older gentlemen, report improved firmness, faster activation, and even visual enlargement due to tissue expansion. This isn't a miracle, it's restored blood flow. If you do this daily or at least every other day, changes usually become noticeable within a few weeks. It's perfectly normal to feel warmth and fullness in your penis after the procedure. That's a sign blood is genuinely going where it should. Just don't rush, don't use high pressure, and never go beyond comfortable sensations. The goal here is to restore your body's natural function, not force it. Think of this as intimate physiotherapy, gentle, regular, and extraordinarily effective. I've had patients tell me after just a fortnight of using this properly, they notice the difference. One chap from Manchester said it was like being 30 years younger. Another from Bristol combined it with the exercises and the recipe I'm about to give you, and he said it changed everything for him. Special recipe: natural blend that boosts nitric oxide and strengthens erection. Right, now let me give you that bonus I promised. If you combine this recipe with the 3 exercises I've just shown you, the difference in erection firmness usually becomes much greater, because here we're working from the inside, directly with your blood. The main ingredient is beetroot, the richest source of natural nitrates. These nitrates convert to nitric oxide inside your body, precisely that molecule which opens blood vessels, improves circulation, and facilitates blood flow to the penis. There's research in the journal Hypertension showing that beetroot juice increases blood flow by up to 40% in older people. That's genuinely powerful. The second part of the recipe is fresh ginger because it improves blood fluidity and reduces inflammation in blood vessels. And to complete the mixture, you use lemon, which helps your body better absorb these compounds and additionally clears circulation. Now pay attention to get this right. Take half a raw beetroot, peeled, chop it into small pieces, grate a small piece of ginger about the size of your fingertip. Don't need more, it's very strong. And squeeze half a lemon. Put everything in a blender and add 200 milliliters of water. That's roughly 1 cup. Blend until smooth. Don't strain it, because the fiber also helps circulation. Drink this 30 minutes before dinner or 30 minutes before bed. That's when your body relaxes and the vasodilating effect works even better. You don't need to drink this every day. 3 to 4 times per week is enough for many people to see noticeable results. Now, let me prepare you for what might happen. The first thing men report is a feeling of warmth in the intimate area. As though blood is starting to flow much more easily. That's exactly what we need. It's a sign that nitric oxide is doing its job. And when this combines with the exercises, the effect usually becomes much quicker. Fuller erections, more stable firmness, and fewer failures. Conclusion. Gentlemen over 60, look carefully at what I'm about to say, because this isn't just about erections. It's about that part of you that you thought was dying slowly and quietly. Loss of firmness doesn't start in your body, it starts in your head. It starts in that silence you feel when you realize you're no longer the man you were. It starts with that doubt you never dared admit to anyone. Is it all over for me? And you know exactly what I'm talking about, don't you? That night when your body didn't respond, that look from your partner that you pretended not to notice, that feeling of defeat you swallowed alone. Let me tell you the truth, harsh but necessary. Doing nothing is the worst decision a man can make. Because when you don't react, circulation worsens, the cavernous tissue hardens, elasticity disappears, and what once failed starts failing every single time. That's how many men give up, and they give up silently. But not you. You've made it to this point. You've heard every word. You understand why your erection weakened, and now you've got 3 exercises and 1 recipe in your hands that can change your story in a completely natural way. No drugs, no shame, no dependence on anyone. That's why I'm going to ask you for one thing, and perhaps this is the most important request in this entire conversation. Share this video with another man who you know is suffering in silence. That mate who's started avoiding intimacy, that brother who's constantly tired, that neighbor who pretends everything's fine, but you know it isn't. One click from you could be the difference between him getting his life back or letting his manhood die slowly. Don't keep this just for yourself. Help another man rise again in body, mind, and life. Drop a comment below telling me which exercise you'll start with, and I'll see you in the next video where I'll answer your top questions about the vacuum pump since so many of you asked about it.